This is your step-by-step guide on how you're going to become a dental hygienist. There's a few different paths that you can take. One is going through a university. You can also go through a community college, and then there are accelerated programs. And through all of these routes, you will have to see real patients in order to gain practice and experience. Through the university route, that's probably going to be around 4 years. I know some programs are 3 years. The community college route will also take you about 3 to 4 years, depending on how fast you are able to do the prerequisites, and you'll graduate with an associate's degree in dental hygiene, even though it does take a total of about 4 years. The accelerated programs are generally less than 24 months, but they are pretty expensive, probably comparable to the university. The community college route tends to be the cheaper option, but it does take, again, 3 to 4 years. No matter what route you choose, you always want to make sure that you go to a CODA accredited program, CODA. Our prereqs are going to include a lot of the same courses that nurses take for their prereqs, so it's going to be mainly science courses, things like anatomy, bio, chemistry, microbiology, physiology. It might vary a little bit depending on which program you decide to go to. When you do your prereqs, it's important to get the best grades possible because dental hygiene programs are very competitive. Make sure you have a backup plan, so pick 2 to 3 different programs that you want to apply to and look at each individual program and find out the requirements for each of them because, again, they may slightly vary. Some programs will have additional requirements like volunteering or shadowing. Once you get through all of your prereqs and you get good grades, you do the volunteer work, you shadow, and you are ready to apply for the dental hygiene program, that's when you'll usually have to wait a little bit to find out if you got in. I applied in January and then I found out in April when I got in. And the program started in August. So sometimes there is a little bit of a waiting period before the program actually starts. When the program starts, this is when things get tough. It's a really heavy workload, a lot of didactic courses while also being in clinic and seeing real patients. You'll take courses like head and neck anatomy, embryology, histology, you'll be in clinic, you'll be learning instruments, you'll be learning how to take x-rays, sterilization. Once you get through the process, then you'll have to take your boards exam, and every state is slightly different when it comes to things like law and ethics, local anesthetic, your clinical board exams. Those vary a little bit by state, but the national board exam is a national exam that we all have to take in order to become licensed as a dental hygienist. It's 350 questions and we all take it. Once you've made it through all the prereqs, the dental hygiene program, and your board exams, then you can apply for your license and become a registered dental hygienist. Once you become licensed, then you have to renew your license every 2 years. And again, this varies state by state, but generally you have to take about 25 units of continuing education in order to renew your license and, of course, CPR. Let me know your questions in the comments.